Sorry, I was muted. I have started recording, and whenever you guys are ready, I think both of our co-chairs are here.
Yeah, and I was trying to match up the participant list with the task force members, and I think we have a good critical mass. Rep. McNamara, Senator Kreider, do you want to kick us off?
Sure. First of all, I want to take a moment to recognize the events that happened in Indianapolis last night, and have a moment just to express some sympathy for the family and the friends of the victims of the shooting that took place, and recognize that the work that we're doing on this task force might in some way prevent something like that from happening in the future, and appreciate people's sympathies for the families and thinking about them, but understand that your role is even more critical in moving forward with this going in the future. Didn't know Senator Kreider wanted to say anything, but thank you guys all for very much for your time on this task force and working on behalf of the juveniles in the state of Indiana.
Thank you. It's good to be with you. I echo the sentiments about the FedEx incident. Have so many friends in the law enforcement world that, you know, a lot of people kind of forget that this impacts them at a level that's caustic also. And so thinking about all the folks involved at this point.
With that, we can turn it over to Nina.
Sure, yeah, and I wish it wasn't such a somber note, but definitely echo your sentiments about the victims and their families in Indianapolis. I know this is a tough day for a lot of folks, and so appreciate everyone's time and attention and commitment to this work and to this work moving forward, and especially to Representative McNamara and Senator Kreider for all of their work and their commitment and leadership on these issues. I'm going to share my screen, which is always a gamble. Let's see here. Okay, can everyone see the PowerPoint? Is that okay? I'm seeing head nods, so hopefully everyone can see it. Okay, great. So for the meeting this afternoon, really the agenda is to provide highlights of the key findings and recommendations that were included in the summary memo that was sent out to the task force about a week ago. Obviously, the memo has a lot of detail in it in terms of our process, and summarizing the various conversations, synthesizing the findings in various issue areas, and providing some recommendations for improvement. And we just want to highlight those key findings today. Obviously, if there are questions or comments or reactions to other things that were included in the memo that we don't go over, we're happy to talk about those as well, but didn't want to overwhelm everyone. And if we went over the memo in great detail, I think we could be here for way longer than 2 hours. So we tried to synthesize that information into this presentation. And we'll have time in between each section to ask for reactions, comments, feedback, and questions so that we can digest the findings and recommendations in a little bit greater detail, and then proceed with talking about where we hope to go next in terms of partnering with Indiana and working with you all to conduct a more comprehensive assessment of the juvenile justice system. So for folks that are newer or for those that are joining by live stream that aren't as familiar in terms of background, the Council of State Governments Justice Center, we are a national nonprofit, nonpartisan organization that partners with state and local policymakers to provide strategic advice, do independent research, and help come up with strategies, with policies to improve public safety and improve outcomes for youth and adults that are in contact with the justice system. And we've been partnering with Indiana over the last several months to conduct this preliminary assessment of the state's juvenile justice system. This preliminary assessment really had the goal of helping to position Indiana to be able to develop a statewide plan for improvement that protects public safety, that reduces racial and ethnic disparities in the juvenile justice system, and overall improves outcomes for youth, including reducing recidivism and improving positive youth outcomes. And to do that, we employed a number of methods, including engaging in conversations with stakeholders across the state and across the juvenile justice and other relevant youth serving systems, engaging in conversations with data and IT staff to better understand the state's current capacity to collect, analyze, and use juvenile justice data to drive continuous improvement, reviewing state statute and other policies and annual reports and other relevant material to better understand the system and the current policies that are in place that make the system operate the way that it does. And also to assess how current statute and legislative code is aligned with what we know from research and national best practices. And we also wanted to recognize and build upon the achievements that have already been made in Indiana's juvenile justice system, such as the JDAI initiative, the dual status framework, and other achievements, including, I know, the recent bill that was just championed and passed the legislature as well, kind of adding to that list of improvement efforts and achievements that the state has already made. Again, since October, we conducted over 30 interviews and focus groups with over 100 stakeholders from across the juvenile justice system, including all of those different groups that you see on the screen and others. If we were to do a more comprehensive assessment, obviously we would be speaking to more line level staff and youth and families, and we can talk more about that later. But we were able to speak with a number of groups, both inside and outside the juvenile justice system. We also conducted over 20 interviews with state and local agencies to better assess and understand the capacity the state has to collect juvenile justice data. This included state agencies and their staff and IT staff, as well as a sampling of 12 county probation departments to better understand how data is being collected at the local level from point of referral through reentry. And so this assessment takes all of that information and synthesizes those findings. And that's what we did in the memo. And that's what we'll present right now in our key findings. And we'll go section by section and then pause again for discussion, reactions, and comments. So we're going to start with the front end of the juvenile justice system, thinking about how kids are referred to the system and looking at diversion from juvenile justice system involvement. And I'll start just by giving a brief overview on what the research says and what best practices are nationally at the front end of the juvenile justice system to give everyone kind of a better frame and context for what we were looking at. So what we know from the research is that most youth grow out of their normal adolescent behavior and stop reoffending without any system intervention. Often what we hear from local and state jurisdictions is that they try and provide youth with a whole host of services, whether prevention or intervention, to get them to change their behavior. But we know that if we do nothing at all, oftentimes youth will just grow out of this behavior and stop reoffending without any system intervention, without any services. And actually, for lower risk youth, we know that being involved in the juvenile justice system actually increases their likelihood of recidivism and also decreases their likelihood of completing school and being successful in terms of employment and other positive youth outcomes. And that diversion is a more cost-effective strategy to improve public safety than arresting or involving these young people in the court system. and also helps to make sure that resources are being used most efficiently across the juvenile justice system. We also know that the nature of a youth offense is not a good predictor of reoffending, that diversion decisions are most effective and equitable when they're guided by objective data, guided by the use of a risk screening tool that can better identify a youth's risk of reoffending, rather than just by going on their offense or prior history. And we know that restorative justice practices are an effective way, and we'll talk about this a little bit more later, for repairing harm caused for victims, as well as a way to hold youth accountable, and can reduce reoffending and increase victim satisfaction with the juvenile justice system. So in terms of Indiana, what we found is that the state lacks the policies and practices to ensure that the lowest risk youth are diverted from formal system involvement. So what we know is that a lot of low risk youth, including youth that have committed status offenses, account for a large proportion of all court referrals in Indiana. And status offenses, for those that are not as familiar, are those offenses for which a youth can be referred to the delinquency system, but if they were committed by an adult, they would not be considered a crime. These are things like curfews or truancy, runaway, etc. So together with property and drug offenses, these offenses comprise about half of all referrals to juvenile court and about 40% of probation cases. And these are approximate, as we talk about later with the data, these numbers come from various sources. And so there's a little bit variation depending upon the source of data that we're looking at. But we know that they account for a large number of referrals, considering that these are often the lowest risk kids. We also know that there's inconsistency and variability in terms of statewide policies on diversion, and nothing really exists in statute or in policy to guide diversion practices. And most counties also lack the opportunity for pre-arrest or pre-court diversion for young people. Really, informal adjustment is the only opportunity in most jurisdictions for youth to be diverted from the juvenile justice system. And as a result, many youth are referred to the system because they are, not because they're a risk to public safety, but because they need access to services. So what we saw in Indiana, and we see this in other jurisdictions as well, is that if kids can't be diverted from the system and get access to behavioral health and other services without court involvement, that young people are often pushed further into the system just to get access to those services, even though those kids do not present a public safety risk. And so are there better opportunities to get these low risk kids access to those services without getting them involved with law enforcement and in the court process? We also saw eligibility for diversion being inconsistent in terms of criteria across the state. Typically, it is offense-based, but that was not uniform in what those offenses are or what those profiles look like in terms of prior referrals or prior histories. And that creates justice by geography, and also can increase the disparities in terms of who gets access to diversion just based on where you live or based on your race, ethnicity, and other more subjective characteristics. For those youth that are on informal adjustments, again, one of the only opportunities for diversion that the state provides, we saw that those supervision conditions are often very similar and comprehensive to those for youth on formal probation supervision. So very little distinguishes informal adjustment versus formal probation, except perhaps the length of time that a youth is on informal adjustment, but they have to adhere to the same types of conditions of supervision that those youth do who are on formal probation supervision. And so just to summarize, we're still seeing a lot of low risk kids that are being referred to juvenile court in Indiana. They're being placed on formal supervision in a lot of instances, and there are opportunities to better use limited resources and focus those resources on those moderate and high risk kids if the state were to divert more kids, these low risk kids, out of the system. So I'll stop there and see if there are any questions, comments, reactions. But first I'll turn it over I want to give Josh and Emily, my colleagues on the line, an opportunity to also provide additional context if I've missed anything.
I'll just add, I mean, I think Nina's comments made this pretty clear, but we appreciate, and it happens in every state, that certainly every local community is different. Communities vary in terms of the services that are available and in terms of their attitudes and norms and policies. And so, of course, some local variation is important and should be respected. At the same time, I think, as Nina pointed out, the current approach to the front end of the system really does mean that the way that justice is administered and who gets diverted versus who becomes formally part of the juvenile justice system is significantly different across the state. And it does mean, based on everything that we know from the research, that resources really are not being used efficiently across the state for services, for court time, for staff time, when we know those low-risk youth are better off outside of the juvenile justice system. Just one other point to add, which is we've actually recently conducted our own research at the request of a funder to look at the difference between placing youth on diversion versus probation. That was a statewide analysis in Texas, and that data showed a very similar story, which is that youth placed on diversion are no more likely to offend than youth placed on probation, but that youth placed on probation, who are the same risk level as the youth placed on diversion, those youth are more likely to get a technical violation and to move deeper into the system. So it's not just important to keep youth out of the system, but as Nina mentioned, the more that any form of diversion really doesn't look like diversion, but actually looks more like court involvement and probation conditions and supervision, the net effect of that in most jurisdictions is pushing these lower risk kids who probably shouldn't have been on any form of supervision in the first place, deeper into the system with more cost, more harm. And generally, these are kids of color who are being disproportionately pushed deeper into the system. So really, as we looked across state policies and state practices, the need to reform the front end of the system and have a statewide vision and approach, we'd probably uplift as one of the most important needs that could have downstream effects on really every part of the juvenile justice system. So questions and reactions for folks, because we really want to make sure we built in time after each section, as Nina said, because we really would like to hear from you about agreements, disagreements, questions, surprises, not surprises.
Josh and Nina, I think there's a question in the chat.
Yep, I see that in terms of the youth diversions disaggregated by race and gender. So in Indiana, we don't have access to that data yet. That would be part of the comprehensive assessment, is to be able to look at different decision points and see where disparities exist by disaggregating the data. But what we know from the research in other jurisdictions is that oftentimes at the front end of the system is where we see these disparities begin to manifest itself in terms of contact with law enforcement and then access to diversion opportunities. And oftentimes this, we see access by geography or by race and ethnicity, that we see disparities in terms of race as well as location.
And Indiana's juvenile justice system, like most around the country, particularly in the last year as a result of COVID, has shrunk in terms of the number of kids getting arrested and the number of kids getting referred. But pretty consistently in every jurisdiction, despite that decline in arrests and court referrals, disparities remain consistent. And in many cases, disparities actually get exacerbated.
Any other reactions or thoughts to this part of the system and these findings? Rep. McNamara, Senator Kreider, anything that sticks out to you or that you want to make sure folks recognize?
Trying to unmute myself. I just know because we spent time last week going over all of the information that they're presenting today. And all I know is we've got a lot of work ahead of us, and we will probably ask you guys to join subcommittees to divide up a lot of this work that's going to head forward and go from there.
This is Rudy Monterosa. As far as reactions, I guess I'm not surprised to hear this information being shared. I know we talked about it in a meeting before, but my experience has been with my juvenile clients. And in fact, when I used to talk to our law student interns who were going to be working in the Juvenile Justice Center, was this fact that if parents, maybe because they didn't speak the language, right? They didn't speak English and they didn't quite understand why the probation officer was calling them to offer them this opportunity to informally adjust or informally take care of the issue, that they didn't trust it until they went to court. And then once they were in court, then they got a sense of, oh, we better pay attention now, we can do it. But by then, a lot of times for our clients, it was too late to be able to take advantage of this deferral or this diversion type of a program. So if we're talking about reforming the way we do things here in the state of Indiana and actually making this statutory, right, to have this relief available statutorily, like the way we have pretrial diversion, I think that'd be a great thing.
Just to put this in context, because I know folks always wonder sort of where do we stand compared to other states. We don't like to make generally state comparisons because every system is so different and the population that they serve is so different. But I think it is important to say that most states around the country at this point, whether they're more progressive states or more conservative states, particularly around the population of youth that commit status offenses, as well as youth that have a low risk to reoffend, have really shifted towards wholesale commitments to divert those young people out of the system. Even typically in our conversations with law enforcement around the country, these are the kids that law enforcement, wants to make sure gets connected to services, but doesn't necessarily want to be arresting or spending their time on. And so it's really a question of developing alternative pathways to services and how to not have the juvenile justice system, which still fundamentally is an adversarial and can be a punitive system, be a default service provider. And we know that can be a big challenge to think about on a statewide basis, but as we'll talk about in a little bit, another way that you're a little bit different in a positive way than other states is you actually have a robust funding infrastructure for services. As states are thinking about the American Recovery Act and the millions and millions of dollars that are available to states for a variety of purposes, the timing is actually ideal to be thinking about statewide policy change and the availability of resources to address needs that maybe weren't possible before.
So I like how Josh gives everyone a teaser of what's to come later when we talk about recommendations, but I think also to Representative McNamara's point as well, we'll provide later on in the presentation examples from other states and jurisdictions around how they've addressed some of these issues. And as Josh mentioned, across the different spectrum in terms of politics that every state has. But one thing as we do dive deeper into a comprehensive assessment would be sharing those resources from other states and jurisdictions, connecting folks across different states to hear about how they've tackled problems with the various committees that we might establish is something that we would do. And so, as folks get interested in potential solutions and hearing more about what other states have done, as Josh mentioned, that would be part of that process. Any other comments, reactions? I see in the chat, Nancy saying that she's not surprised by the findings. Seems like that was the case as well for James at a JDAI meeting in terms of how many referrals are coming into the system for these low-level type offenses or low-risk kids. Any other major reactions before we move on to the next section on detention? Okay.
Hey, Nina,
Yep.
I have a question. So does any of your findings talk about the involvement of your stakeholders, meaning that the people who are not a part of the system, when you're talking diversions as far as the school systems are concerned? At one point in time, we represented over 25% of your referrals for statute offenses and things like that. So as times change, I'm sure those referrals will get back up to about 25% again in light of COVID and all of the trauma that has taken place during our time out of school. So with that being stated, I on my JDAI meetings and a lot of other meetings, I've heard a lot of talk about policy changes and things like that. But your main stakeholder, you have the community in general by itself, then you have the schools, which constitute a lot of the juvenile kids. And we see things coming way before you guys do. So when schools are engaging in their own diversion programs, that's an asset to everything that we're trying to accomplish with this committee. So I haven't heard any conversation about how schools can play a major part in keeping kids out of the system by working with you all on those particular diversions.
That's a great point, and we'll talk about that a little bit more when we get into recommendations, because we did have conversations with some school district officials as well as the State Department of Education to talk about school referrals and status offenses, particularly truancy. And what we found is that it depends on the jurisdiction. There are some jurisdictions where those kinds of offenses are automatically referred to juvenile court, and kids are even getting detained for truancy and other types of those school-based referrals. And you have other jurisdictions where schools are handling those offenses completely in-house by referring kids to services, access to counselors, or whatever other types of supports in schools. So I think it varies considerably depending on the county in Indiana. And in terms of recommendations, we'll talk about how these kids and their families are better served outside of the justice system,
Right.
whether by collaborating with schools, with community-based providers, the behavioral health system, child welfare, et cetera, before they get to court, so that court isn't the main provider of those types of services.
Appreciate that. Thank you.
That's a great question. Any other thoughts? Okay. So our second section focuses on the use of secure detention. And in terms of research or best practices, what we know is that detention, placing youth in secure detention can have a significant impact on a young person's mental well-being and physical well-being and other outcomes, and can actually increase their likelihood to reoffend. And so secure detention should be reserved for only those young people that pose a direct risk to public safety, or they present a flight risk from prosecution. Additionally, we see that most states around the country have eliminated the use of detention as a response to a technical violation or for failure to comply with supervision. Again, only reserving detention for those youth that are an imminent risk to harming other people and to public safety. Using detention screening tools to guide decisions around detention, and also establishing criteria and policies and providing training to folks who are using that detention screening tool and making those types of decisions, taking the results of the tool and determining what the response should be. And then establishing a continuum of alternatives in the community so that youth are not placed in detention, but they are matched to services in the community, or if they need supervision pretrial, that are based on their risk to reoffend and based on their individual needs. And I know this is an area where Indiana has done a lot of work in terms of the JDAI initiative, and we have seen a significant decline in admissions to detention in Indiana as a result. But we are still seeing that youth are often detained in Indiana for non-public safety reasons. And that disparities in terms of race and ethnicity for detention admissions has remained a significant concern. So one of those ways that kids who are not a public safety risk are finding their way into secure detention is that Indiana does not have a lower eligibility age for secure detention. So you can see youth as young as 8, 9, 10 being placed in secure detention. And these are youth that don't necessarily pose a public safety risk and probably would be better served outside and an alternative in the community. Second, we found broad discretion in state statutes in terms of how detention can be used for non-public safety reasons, such as to get access to behavioral health resources, for protection in terms of youth that might be suicidal or at risk of self-harm, for youth that have issues with their family and their place of residence, and other reasons that are not public safety in nature. We also see in Indiana that youth can be placed in detention as a disposition for upwards of 90 or 120 days, depending on the age of the young person. And that detention can also be used as a punitive response to a technical violation of probation. Again, a policy that we have seen a lot of states at this point eliminated. The use of detention screening tool is being used in some jurisdictions, but not in all jurisdictions. And the way that it's being used is inconsistent, whether after a detention decision is being made, has already been made, or whether to inform that decision. And again, while we've seen a large decline in terms of detention admissions, we've actually seen the length of stay in detention increase for all youth, but particularly for youth of color. And the reason behind that is still unclear, whether that's a lengthy court process or for other reasons. But we're now seeing kids in detention for an average of more than a couple weeks. Again, I'll pause here. Emily, Josh, anything to add before we turn to comments, reactions?
I think just to say this is probably pretty obvious, but the research is pretty clear that detention is not a good place for kids, that detaining kids can increase their likelihood of reoffending, that certainly increases trauma, and there's been no research or evidence to suggest that detention is an effective deterrent. So the idea of detaining youth as a punishment or a response to technical violation, or because they didn't follow a judge's orders or probation conditions, there's no evidence to suggest that that's an effective way to shape young people's behavior. And everything we know from brain science suggests that it's more incentives that young people respond to than severe punishments. That doesn't mean that graduated responses aren't important to hold young people accountable, but detention has all sorts of negative research-based effects. And so as Nina highlighted, currently right now, both permissible by statute and common practice, youth are being detained for all sorts of reasons that aren't necessarily research-based.
I have a question about the, forget where it was, maybe the third or fourth finding down about, I think it said that youth are detained as disposition frequently and then as a punitive response to probation violations. Was that a finding from the interviews, or was there some data to support that, or both? I'm just wondering kind of where that information came from.
Yeah, it was both. You know, we hesitate, obviously, because we didn't do our own data analysis, and these are data sources, multiple data sources providing different statistics. And so hesitate to put anything in a PowerPoint in terms of actual numbers. But we did find that in some of the reports that were provided to us, as well as obviously statute allows for that to happen. And then in terms of practice, when we had conversations with the various county departments as well.
Thank you.
And Nancy, that's the kind of thing that if we were able to do a deeper dive, we would try to do that analysis for ourselves. I mean, there was at least one report that we looked at that I think was like a statewide report that suggested the dispositions were, you know, in the hundreds, if not thousands. You know, whether that's mixing data points or mixing actual reasons, you know, that certainly raised questions for us. But as Nina said, both in the data and qualitatively, it certainly appears to not be an uncommon practice.
Thank you.
Yeah, I'm wondering, I mean, that raises a good point. I'm wondering if for the, the attorneys or the county folks on the call, is that something that resonates in the jurisdictions that you're in? Are these issues that you have also found, are they aligned with, what you're seeing? Would be helpful.
I'm not one of those people you referenced, but I can say from the JDAI sites where 71% of youth aged 10 to 17 reside, it does not seem to be very common. And I think that's why I was asking. We have a way of knowing youth who are confined post-dispositionally for that reason. Not awaiting, well, we can tease out awaiting placement or other things, but and so I don't have the data in front of me. It does not seem to be used a lot, but maybe I'm not accurate in my understanding.
The times that I see kids placed in detention post-disposition is when there has been a probation violation and then the child is put on a hold due to that probation violation. I don't see it used frequently as an actual tool of the actual disposition order. But like I said, it can be used with some frequency when there is a violation that has been committed. I think you also addressed one of the main concerns that I had with the minimum age, and no minimum age for detention, no minimum age for delinquency adjudications. If 368 is signed by the governor, I'm really hopeful that it will be. We're going to see potentially 100 or so kids or more that are charged with crimes that may be held in secure detention facilities that are currently being housed in county jails. And if we do that, we may want to more seriously think about the propriety of keeping younger kids in the secure detention facilities with a population, the majority of those kids that are charged with crimes are 16 and 17-year-olds who are direct file kids.
Mm-hmm. Yeah, that's a really good point. And we've seen that in a number of other states. We're currently working in Connecticut, where they have a bill this session as well to transfer responsibility for kids being held pre-trial in the adult system back in the juvenile system. And they're having to rethink what their detention facilities look like and how they support the needs of those high-risk kids compared with the rest of the population that's currently in detention, and how do they, separate, and how do they house, and all those kinds of logistical issues as well. So that is definitely something to think about in terms of getting those low-risk kids that don't need to be in detention in the first place into an alternative in the community, and building out that continuum of alternatives.
I think it's important to add, just in case it's a thought that's beginning to float around people's heads. I mean, I appreciate the comments so far, but one of the things that we try to pride ourselves in is having a balanced focus on what's good for kid outcomes and equity, what's good for public safety, and what's also the most efficient use of resources. And the things that we've highlighted so far, trying to keep lower risk kids out of the juvenile justice system, trying to reserve detention only for kids who are public safety risk, those fall in all of those buckets. So those are all potential reform areas that would have a meaningful impact, not just on youth outcomes, but on system equity, on public safety, because pushing kids deeper into the system and detaining kids for non-public safety reasons actually increases their likelihood of recidivism, and also on the use of limited resources, because if kids are served outside of the juvenile justice system, then resources can be reserved for the highest risk kids, and detention as well. Obviously, detention is not just a serious intervention, but also a costly one. And so all of the issues that we're highlighting, and as Nina will get to the potential recommendations, we feel like could have significant impacts and benefits in all of those areas.
All right, I will move on to the next section. So the next section is around, the hard part in switching back and forth. There we go. Is around dispositional decision-making and supervision. So again, to start with some of the research and best practices. What we know from the research is that youth should be matched with the most appropriate disposition based primarily on their assessed risk of reoffending, and that out-of-home placement for young people should be reserved only for those kids that pose an imminent public safety risk. Supervision intensity and the time on supervision should also be based on a youth risk level, as well as their progress in treatment. Conditions of supervision should be limited and tailored to the individual young person and the root causes of their behavior, and should focus on restorative practices. Probation officers need to be reconsidered or repositioned as agents of behavior change rather than focusing on compliance or punitive measures, and really need to help youth build the necessary skills to be successful outside of the justice system. And that probation systems should employ graduated responses and incentives to hold youth accountable, to address misbehavior, but also to promote positive youth behavior and therefore minimize technical violations of probation. So in terms of Indiana, what we found was that while there are a few counties currently looking at transforming their probation supervision policies and practices to align better with risk need responsivity and what the research shows, that across the state, we're not seeing consistency in terms of how those dispositional and supervision decisions are being made aligned with what the research shows works. So we don't see dispositional decisions consistently being informed by the results of a risk needs assessment, while the state does have the IAS, the Indiana Youth Assessment System suite of assessment tools, that it's not consistently being used to inform dispositional decisions, and stakeholders often found the tool results to not be credible or aren't giving it much weight in terms of using it for decision making, and that there is very limited criteria in terms of how to use out-of-home placement to guide those types of decisions. We also saw policies and practices around probation to be very different across the state, and having technical violations still be a large driver of further system involvement. Here we have a data point again from one of the sources that were provided to us. If we were to do this type of assessment, that is something that we would definitely look into deeper in terms of technical violations and how they are a driver of the system. But this data point in 2017, almost 26% of referrals to probation were for technical reasons. Again, the definition of what that means and how we're using technical violations can be different across counties given the lack of standard definitions. While we saw overall admissions to the Department of Corrections Division of Youth Services decrease significantly over the last several years, similar to other states and jurisdictions, racial and ethnic disparities in terms of commitment is still a significant concern. In 2019, about a third of kids in DOC custody were Black youth, but at the same time, Black youth only represented about 15% of Indiana's juvenile population. And then the last point, I think we talked about this a lot at our January meeting, we found transitional services and supports to be lacking for a lot of youth that were being released from DOC custody. And that type of support and supervision for those young people was very different depending upon the county that they returned to. So for certain offenses, the DOC provides parole supervision and support. For some jurisdictions, probation departments take over authority for those young people coming out of DOC and providing supervision and transition or reentry support. But for the majority of kids, they're being released from DOC custody into the community with very little support in terms of finding access to needed resources, housing, education, employment, et cetera. And so that variability exists around the state. Questions, comments, reactions, added thoughts?
Nina, this is James. You mentioned number of juveniles that are, I don't know if I understood it correctly. Is that are incarcerated in DOC facilities?
That are in the juvenile system, in the
In
division
the
of
total
youth.
system?
Yeah, that are in the Division of Youth Services that are incarcerated in their 3 facilities. Yes.
Okay.
I have a quick question on this slide before this, where I think the best practice recommendation about time and intensity of supervision on youth level, in terms of the word treatment, is that, when I hear that, I think of like mental health treatment, and I'm still trying to think about diversion and not having youth on probation, particularly for with a primary need being a mental health condition or something along those lines. Is that what that means in terms of use of that word, or is that something different?
Yeah, so this is referring to, for those kids that are on probation supervision or are committed to DOC custody, that their length of stay, their time on supervision should be informed by their risk level, by the severity of their offense, but also in measuring their progress on whatever their treatment plan entails, whether that could be behavioral health in nature, it could be other treatment needs, but that their progress on their case plans should really be taken into consideration as you're looking at how long a young person needs to be on supervision.
Yeah,
Thank
Nancy,
you.
maybe the word treatment isn't quite the right word. What this is trying to get at is, in Indiana, like a lot of places, often probation terms are arbitrary lengths of time. A youth is placed on probation for 6 months or 9 months or 12 months without accounting for one, what are actually the goals of that probation period, which should be more than just supervision, but should be positive youth behavior change. 2, that youth who are higher risk might need a slightly more of a touch around supervision to make sure that they're participating in services to achieve those goals. And that discharge from probation shouldn't, again, be kind of just an arbitrary time frame, but should be based on some success towards achieving those goals. So it speaks to both the importance of having probation be purposeful and not just about kind of compliance with conditions, and also just the amount of time not being arbitrary, but based on some set of goals and progress.
Thank you. Appreciate the clarification.
Nina and Josh, on the same slide under the first bullet, it talks about limit of out-of-home placement. Can you define that? Is that residential treatment? Is that Division of Youth Services? Is that what is out-of-home placement? Can you describe that?
Yeah, so here the use of the term out-of-home placement refers to those kids that are in residential treatment or in commitment in custody of the state, whether that's in one of those 3 facilities, as well as community-based residential treatment, but not getting treatment in the community is what that means.
And Don, we'll talk a little bit, the next section I think deals more directly with services, but I think it's important. Your question is really important because sometimes people think differently about incarceration in a secure facility, with the Department of Corrections than they do about a residential program. And actually the research suggests that outcomes aren't great in either. Certainly if a young person has, a very high-end intensive kind of mental health or substance use need, a residential behavioral health treatment might be required, although the research generally says that meeting, the vast majority of young people's behavioral health needs in the community is more effective and certainly more cost effective. But that people often draw artificial lines between incarceration in a secure facility, incarceration in a non-secure facility, a group home, a residential treatment center, and really all of those are forms of out-of-home placement that research has generally shown are more costly and less effective for not just lower risk kids, but higher risk kids as well.
The interesting correlation there is you're suggesting youth for reserving for those that are pose imminent risk to public safety, and the guidelines under FFPSA are suggesting those kids that have a clinical need for residential placement. So balancing imminent risk versus the treatment needs through FFPSA, and we're just trying to get alignment there.
Yeah, and that's where, again, this is the juvenile justice system, right? And so if a young person's primary need is a behavioral health one, then that need could be met outside of the juvenile justice system, and generally should be met, if it's in the juvenile justice system, in the community. But if they're served by the juvenile justice system, they really shouldn't be, deprived of their liberty and placed out of their home unless they really are a significant public safety risk, or their behavioral health issues are so acute that they can't be met in the community. And we know that might bring up questions about, well, are there sufficient community-based services? And we'll get to that in the next section. But that's where rethinking some of the current use of resources and some of these resource efficiency opportunities that we're raising could provide an opportunity to build some of that more community-based capacity, so service availability doesn't become a reason to place a youth out of their home.
Thank you. And that was what I was hoping to hear.
Yeah, and that alignment also done with Family First is something that we would definitely look at as we're working on these issues with the state, because even with Family First, right, the goal and objective is to try and serve these kids outside of residential placement and limiting those placements. So making sure that there's alignment across the different policies around when kids can be placed and for what reasons is going to be critical. And we've been doing that with other states.
One thing just to uplift in this section, Nina, if you just want to go to the next slide. As Nina mentioned, this data point that we have, which again, I think is pulled from one of the statewide planning reports, there's certainly some question marks about are 26% of all referrals and kids who are placed on probation for technical violation or administrative reasons, because in many places, sometimes a technical violation isn't a true technical violation, it's just done instead of a new offense. But that's a really significant number. And just to break that down, what that means is essentially, if that number is correct, a quarter of all new probation cases are kids who are already on probation, or I guess they could be on some form potentially of informal supervision, and they're getting a technical violation of the conditions of probation. So that really speaks to what we were talking about before, which is one, how technical violations can result in pushing kids further into the system or keeping them on the system longer. But then two, also speaks in some ways to the approaches of local communities and how they're responding to not necessarily new offenses, but to technical issues such as curfews or positive drug tests or other issues, and that level of frequency of probation violations, as opposed to finding other kind of incentive-based or graduated responses that ensure that youth are kept in the community.
And I think Josh, that's a great point. I one of my priorities from looking at this would be to see if Nancy and I and her team can come up with some more recent data other than 2017, even if it's not, it's only 2 or 3 counties, or somehow extrapolate this, because I'd really be curious in what direction that's going. And then you're absolutely correct. You need to be able to break down that 25.6% as what the real reason is, right? But that's certainly a red flag. It would be a priority to drill down deeper.
Yeah, and again, this is the benefit of, if we're able to do this deeper dive assessment, is that we can do, again, to the extent that the data is available, we can do that deep dive data assessment, look at individual cases, peer under the hood and make sure these numbers are valid. But also, again, if the data is available, to disaggregate that number further. Is that happening more in rural counties versus urban counties? Is it happening more for youth of color, or often in some states it's girls, that they're getting those violations for their quote unquote protection or for services rather than for public safety reasons. So as Nina's been laying out, certainly did a lot of work, and these are our initial impressions. And as Rep. McNamara said, feels like there are some big opportunities here to rethink statewide policies, practices, and funding. But a deeper data dive can both help tease out the problem and make sure that to really validate to what extent it's a concern.
And I also think, and we'll get to the data section in a couple minutes, but I think this is an area where we could also help identify data measures, data definitions that could create, this kind of data for you in the future if it is not available right now in most jurisdictions, to really tease out what is a technical violation, and so that every jurisdiction is defining that in the same way, and you're really able to understand the reasons behind violations, because a lot of states and jurisdictions right now can't identify whether it's a new offense or an actual violation, or if it's been pled down to a violation, or how that looks across the state. And so if that data is not available, which I would guess is not consistent, that's something that we would help the state do, is create those measures, identify what they should be, and help create standard definitions so that you could collect that data in the future. So Joe, go on to the service delivery section in terms of research and best practice. So I think this has been mentioned a number of times already, is trying to prioritize the limited resources that are available on the higher risk youth, on moderate and high risk youth, and not on lower risk youth. Matching youth and targeting their individual needs in terms of service matching. Making sure that youth are engaged in services and are receiving the appropriate dosage, and that services are being implemented with fidelity to their research. Making sure that services are research-based. Don't want to use the word evidence-based, because people often think that that means those expensive off-the-shelf type programs, but research-based services can also be those more locally homegrown types of programs, and making sure that there are processes and protocols in place to measure fidelity of implementation, to hold providers accountable for service effectiveness and getting better outcomes for young people, and then using that kind of information to direct resources to those programs and services that we know are more effective in reducing recidivism and improving youth outcomes. So as Josh mentioned, Indiana does have a pretty unique and great infrastructure for supporting community-based and residential services for juvenile justice kids. But there's a lack of policies and processes in place across the state to ensure that those resources are used most efficiently and effectively for this population. So what we found is that the way that services are funded through DCS are not always directly targeted to address the unique needs of youth in the juvenile justice system. A lot of times services are addressing the needs of youth in the child welfare system or dual status youth, but we also know that youth in the delinquency system have distinct needs as well. And that it's not necessarily based on a data-driven assessment of the population that's being served by these service providers. There's also limited policies to ensure that counties are using their funds through DCS for the most high-risk youth, and that youth are being matched to services based on their actual individual needs. We also found that a lot of probation departments are relying pretty heavily on residential services, those out-of-home placements that we were just talking about, regardless of availability of community-based services. But at the same time, we did hear from jurisdictions that felt like they were lacking the necessary, more intensive behavioral health or family treatment type service options in the community. And as a result, we're relying more on residential services to address those types of intensive needs. And then lastly, a lack of formal quality assurance policies, protocols, tools in place to evaluate the fidelity of implementation of these services, making sure they're adhering to the research and that they're effective in terms of reducing recidivism and improving outcomes. And there are a lack of processes to make sure that providers are held accountable for actually achieving their intended outcomes, and resources being allocated to those providers that are achieving those outcomes. And there's a lack, the other one thing I wanted to add, and we'll get to this a little bit more in the data section, is that there's a lack of data that's available on service providers that are providing services to this population in terms of kids' participation in services, whether kids are completing services or if they're successful, lack of evaluation of these services across the state in terms of how they are working or not working for young people. And we'll talk a little bit more about that in the data section. But I will stop there in the interest of time and see if there's any questions, comments, reactions. I don't know, Dawn, if you have any thoughts to that. I know we spoke with a number of folks in your department as part of this process. You know, I know there's mechanisms already underway for improving the service array and protocols.
Yeah, and that certainly goes along with our implementation of FFPSA and looking at services, but nothing in that data really surprised me. You know, there have been some increased or improvement or reduction in children placed out of home over the last several years. You know, we are at a lower point, but I would still agree that there are still some counties that use residential treatment as the first option, as opposed to trying to explore what could be available in their community. And we do have some areas in the state where we do have a lack of services. So that doesn't surprise me at all.
I think it's just important to uplift that this is really hard to do well. If folks remember where we started at the first task force meeting, we presented the case study of Texas that had invested hundreds of millions of dollars in enhanced services and didn't experience any improvement in recidivism rates across the state, despite those significant investments. It's just much harder than it would seem on the surface to make sure that services are matched to kids' underlying needs, to make sure those services are research-based and that they're implemented with fidelity and that kids actually engage and successfully complete those services. And so the concern here, you know, is that Indiana is spending millions of dollars on services for this population, but doesn't have the assurance that I'm sure policymakers, juvenile justice agencies, and most importantly, youth and families would want, that those services are actually, you know, being used both efficiently and effectively.
Yeah, that was my thought as Nina gave that presentation. So you've got these service providers and there's no consistency across the state. And so would our effort help to, one, provide data for the services that they're providing and at least bring about some consistency? And I pose that as a question.
Well, I will respond first that there are service standards by the Department of Child Services that the providers are supposed to have consistency in the services being delivered. Where there's some inconsistency is where those services can be delivered because we don't have providers in certain regions to provide those services. So I think there are 2 points to that side, but there are service standards by the department that says if you provide home-based casework, here's what you should be doing for that. But when it gets beyond that into the evidence-based process, or as Nina said, research-based process, we don't have the data that would suggest that there's fidelity to the model on some of those research-based programs. And Nina and Josh, correct me if I'm wrong there.
Right.
Yeah, I think it would also, speaking of what James was saying, in terms of shared performance measures. So looking at what are the measures that we're going to be holding providers accountable for? Are there certain shared measures that could be looked at across service providers working with youth in the juvenile justice system? Obviously, there's measures that are individual depending upon the program or type of service that's being provided. But are data being collected around what youth are getting, what types of services they're being involved in while they're on probation or in commitment? What is their dosage? How long are they in these services? Are they completing their services? What does success look like? These are measures that are right now we don't have the answer to. And that's something that we have seen states starting to do in terms of developing those types of performance measures and then using that kind of data to really direct your resources to those programs that are working with particular populations.
I think it's also important to add, it's not just about setting standards and accountability for providers, but it's also for the counties who are using these funds. to make, and you know, obviously this is all for this task force and lead and all of you to consider, but it's making decisions around, is it okay for a county to use residential services for lower risk kids or even moderate risk kids without any kind of guardrails or improvement process? Is there policies that you want to establish to make sure that if a kid is referred to a substance use program, that they actually have a substance use problem, which is, you know, incredibly common for every kid to be referred to a substance use program? You know, is it going to be a standard that counties have to have certain research-based policies and practices for how they oversee those services and how they ensure that young people and families actually engage in those services, that those services are culturally competent? So it's really thinking through a statewide approach, and as Nina's talked about, an accountability structure, not just for the folks who are providing for the services, but for the folks who are accessing all of these dollars.
Is it as simple as a rubric, or is it a lot more complicated, like requiring submission of data, let's just say to DCS or to a central performance hub, or what does the big picture look like?
I think it's a combination. I'd let Emily weigh in as well, but I think it is some sort of performance reporting or data reporting as part of receiving those funds. In terms of a rubric, I don't know exactly, but I mean, we have seen jurisdictions and states establish tools to help them better match young people to services based on their needs, to know what services are available in their communities that target specific risk levels of young people, as well as specific behavioral health and other treatment needs, so that probation officers and others making those referrals have that information at their disposal. And then, yeah, in terms of performance measures, sharing that information back with the counties, with probation, as well as with DCS as part of their contracts or as some sort of provider accountability system as well.
So Nina, what I would say to that, I think the conversation centers around coherence. And for the state of Indiana, because so many things are not coherent as far as the consistency of different regions, like Gary has different services. Gary goes about things, Lake County goes about things in a different way than Marion County. They have different relationships with their juvenile justice agencies. So with that being said, the providers in those cities are different. The educational levels are different. I know from a school's perspective, we look at the 6 zip codes that we deal with and we dig into the data to see what are the major concerns for the kids in those areas. 46218 is different from 46219. So what it sounds like for the providers that are serving kids in certain jurisdictions, there has to be a massive data dig to see who you're serving, to see what the needs are of those populations are. So it's pretty important, because when I say that the educational level of the different services being provided, you got some mom and pop organizations versus some corporate type organizations. You go from grassroots to community to corporate service providers. So some of the grassroots organization services are pretty dang on good. So when you start talking evidence-based practices, and some of the grassroots organizations may not have the wherewithal, they don't have the MSWs, the licensed LCSWs, but they provide great services. So we're talking a good person environment fit, and we're talking culturally, not culture based on race, but the culture of that environment that you're serving. Those things are important to look at. So it's not a cookie cutter approach. All of the regions are different in how we service our families.
That's exactly right. And that's why I think, I mean, right now, the system, and Don can speak to this better than I can, in terms of using the regional service councils and determining the needs of that particular community and what services would meet the needs of the young people in that particular community, and then what providers can respond to those needs. That system that's in place is a good system. It's just that right now, the juvenile justice system is not integrated really into those conversations.
Right.
And so while we're doing a needs assessment, it's not fully involving the needs of kids in the delinquency system. And so is there a way to better integrate those agencies, those actors, those stakeholders into the conversation so that those needs are included in whatever needs assessment report is provided up to DCS to identify the service needs of that particular jurisdiction, and ultimately who gets funded to comply with those services. But that's why also just to your point on the evidence base, that's why it's important. And I was using the term research based because
Right.
we don't want those homegrown mom and pop organizations and providers to not be part of the service array. And that's why having data is important to show that they're effective, but they don't need to be these, cookie cutter off the shelf MST, FFT type of programs to be effective. We know that there are a lot of localized programs that can also be effective. And so using the term research-based or promising practices or whatever we want to call, but making sure that they are collecting data and demonstrating effectiveness in some way.
Thank you.
Nina, well said. I don't know that I have to add anything to that, but the one thing I will add is the comment that was made earlier on the data is how those programs are utilized by the local juvenile justice system as well. And sometimes they use services improperly or they don't match the service to the needs of the child as well. So that's another consideration, what we have in the communities.
If I may ask a question, and apologies for being on the call late, so this may have already been shared, but were there providers who were interviewed for the assessment?
Yes, so we did focus groups of both community-based as well as residential providers. And then also spoke to, and I don't know, Emily, if you remember the acronym of the Association of Providers as well, but we also spoke to staff at that association.
IARCA.
Yes, thank you.
So I don't know many of you on this call, very few in fact. I represent an agency who serves southwestern Indiana and parts of some other counties in Indiana on the south of Indianapolis. And I'm just curious, like, can we see who were informants for this, the names or agencies they represented? And I'm really just curious, as my agency wasn't included.
Yeah, I mean, we have a spreadsheet that we're happy to share. I think we did at some point in time to make sure that we're getting representative sample of folks. Again, if we were to go forward, and we'll talk about this in next steps, and doing a deeper dive assessment, which is the ultimate goal, we would have a lot more focus groups and individual conversations than we were able to have for the preliminary assessment. For this assessment, we just wanted to make sure that we were speaking with a representative group from different stakeholders from different parts of the state. So
yeah, I would just be curious who the stakeholders are from the area I'm from. Yep. That we're informing.
Yeah, would be happy to share that. Okay, so I'm going to go on to the next section around ensuring that the juvenile justice system is aligned with what is developmentally appropriate in terms of the research on adolescents. And so what we've seen in the last several years is a lot of emerging research on adolescent brain development that demonstrates that youth are not mini adults and that they have very distinct needs. They often engage in risky behaviors. They tend to not account for long-term consequences of their actions. They're relatively insensitive to degrees of punishment and struggle to regulate impulses, emotions. For those of you that have adolescents in your home, I'm sure that's not a surprise. We also know that supervision and services should be based on promoting positive youth development, not based on punitive approaches, but rather one that involves improving family engagement, one that supports improved employment and educational outcomes, supporting positive attachment to peer networks. That system intervention should really be tailored and individualized to each youth, and not treating youth in the juvenile justice system as a homogeneous group. and making sure that youth are held accountable in a swift way, that they know that there are consequences, but that they're held accountable in ways that repair harm caused to victims and communities. And that goes back to the whole restorative justice approach that we talked about earlier. So in terms of where Indiana stands in terms of a developmentally appropriate approach, again, Indiana does not have a lower age for juvenile court jurisdiction. One statistic that we found in a report was that in 2018, almost 10% of all referrals to juvenile court were for youth ages 12 or younger. And what we know from the research that these are youth, these are children and their families that would be better supported and served outside of the juvenile justice system if they do need services, but that the juvenile justice system is not as appropriate for providing those types of services to these young kids. We also know that Indiana imposes as many as 7 different types of fines and fees on youth and families as a result of court involvement. That includes fines and fees for participation in services, for being in court, for defense, as well as for other, for confinement, as well as for other types of involvement in the juvenile justice system. That there's still a number of punitive policies and programs that are in place in Indiana that have been demonstrated by research to not be effective in reducing recidivism and improving outcomes, such as the use of a boot camp, imposing isolation in correctional facilities, and other collateral consequences, such as barriers to employment or education for youth that have been involved in the juvenile justice system. And lastly, that there is broad statutory discretion for waivers for youth into the adult court system, and that there's a fairly long list of offenses for which youth can be automatically transferred to the adult system. And another data point that we found here was that in 2019, Black youth comprised about 2/3 of all direct files, and about 70% of all waivers to the adult system were for Black youth. So these are just some ways that we have found that there is misalignment in terms of the juvenile justice system in Indiana with what we know from the research is appropriate for adolescents. Any comments, questions, reactions?
Nina, I'll just add that those statistical figures you gave on Black youth, they really don't align when you look at the Black male population in the state of Indiana. The total Black male population is 4.5%. And so that's slightly over 300,000. And then when you start talking about youth, it's an even smaller percentage, you know, but I mean, 70%, I mean, that's just, we've got to do better.
Other thoughts, reactions? Doesn't seem like there's many surprises in that section. Okay. I'll keep going in the interest of time as well. So the last section around findings is one that we spent a good amount of time on back in January in terms of data collection and making data-driven decisions. And I'll just summarize again. I don't think this is new from the conversation we had in January, but that there's limited capacity right now in Indiana to collect, track, and use juvenile justice data to drive system improvement and to evaluate youth outcomes. There's a lack of statewide performance measures to really understand and assess how the juvenile justice system is performing, if it's working, if outcomes are getting better. There aren't any standard data definitions or standard data practices across the state, very minimal reporting requirements around juvenile justice data. limited data on youth outcomes, including recidivism, as well as other positive youth outcomes that are being collected. While, for example, the Department of Corrections is calculating and reporting on recidivism, they're really just using reincarceration and not multiple measures of recidivism. And when you're looking at local juvenile justice agencies, there's very little recidivism calculation or reporting that's being done. And oftentimes these agencies have to do hand counts or hand matching in order to track and calculate recidivism because of the different data systems. I know we talked a lot in January about the inability of Indiana to track youth across the juvenile justice continuum from point of referral or arrest through reentry, given that there are multiple data systems being used across the state and by different parts of the system, and that there isn't a unique student or youth identifier number that can help create linkages across these different data systems. And then lastly, that there is limited capacity at the state and local level to conduct data analytics, to look at accountability of the system, and to use data to drive quality improvement or continuous improvement processes. This includes a lack of dedicated staff to do data analytics at both the state level as well as local juvenile justice agencies, the lack of necessary technology or technological infrastructure in terms of data system capacity, and very few minimal policies and protocols around how to use data across the system to drive continuous improvement. And this chart is one that we included in the memo that really shows all of the different data systems that are currently being used by state and local juvenile justice agencies to collect and track data on youth in the system. And you can see the various systems being used by local juvenile probation systems, by local juvenile courts, by secure detention, or to collect data on youth that are being admitted and being held in secure detention, and then as well for youth that are being held in DOC, DYS custody that are committed to the state. And again, not only are we using multiple data systems, but these data systems can't talk to one another. You cannot follow a kid in most cases across these various data systems as a youth moves through the juvenile justice system. Emily, anything else that you'd want to highlight on the data section that I didn't go over?
I think you covered it really well. I think I would just want to emphasize how important it is to attack this from multiple angles. So you need to know what you want to measure in order to identify the data elements that you need. So you both need to know what performance measures you want to include, but there also needs to be a plan in place to collect quality information. So to make sure that you're capturing the data in a consistent way across the system, that you can merge information from multiple systems together so that you're able to take the view of the system that you want to get. So it really is something that needs to be addressed very comprehensively in order to be done well.
And I'll just add that as Emily and Nina have described, some of that doesn't require any money in terms of establishing statewide performance measures and definitions and quality standards. Some of these technology issues might, but again, the timing could be good here. I mean, certainly there are a lot of needs, I'm sure, and priority statewide, but as part of the American Recovery Act, Indiana as a state received over $3 billion. And so thinking about targeted investments around building up the statewide data capacity, data is, not the most exciting thing in the world, but we often say strengthening your data and analytic capacity could be the single most effective recidivism reduction strategy.
So again, I know this was a large focus of our conversation in January, but any other comments, questions right now on the data section? We'll go into some of the recommendations that touch upon what Josh was saying in terms of the more near term, less resource intensive types of recommendations.
Yeah, I think this is all great. And it's my fault for not being able to get back to you. I think the juvenile probation, I think that information needs to be updated, and I think there may be a little bit of a disconnect in those systems. being identified as separate systems when they're really not separate systems. But that's a minor point in the big picture. But I just said that to remind myself to get you a more current reflection of that so that you can incorporate that.
Can I add, Nina, could you go back a couple of slides to the one before this one? Yeah. So I think I think that I understand that there is not statewide, but to say that there's no standard definitions, we have, again, 33 counties that are involved in JDAI, and we have very clear standard data definitions, very clear ways of, we've spent a lot of time and effort at increasing capacity and quality improvement processes. Yes, I understand that sounds like only a third-ish of the counties participating in JDI, but we're also, again, touching 71% of the youth in those 31 counties. And so, yes, I don't disagree with the statement, except I kind of I wish it said something like except in the JDI counties, because I think that some of the things you're pointing out have been addressed. And there is a lot going on that on this slide is, happening in the JDI counties. And I'm just not sure that that was accurately, or maybe it's accurate, but not accounted for.
Yeah, no, that's fine. And I want Emily to respond to it because she knows the data more. But I do want to say, I think in the memo we did this, and we didn't do this in the presentation, that the goal is to build upon what JDI has already accomplished in terms of laying a foundation for data collection. But sorry, Emily, go ahead.
Thank you. Nancy, I want to thank you for highlighting that. I think Nina is right where the slide cut out a lot of good information just for the, just to get through the presentation, to communicate the main points. But there is a lot of positive work that's been done in Indiana. And I think JDAI definitely offers a model for what can be done when people come together and decide on performance measures and learn together how to improve the quality of the data captured, and then actually use that information to make decisions. Because I think that that's one of the disconnects that I see in the interviews that were done outside of JDAI. There weren't a whole lot of processes where data was being used to inform decision making. Within JDAI, you absolutely see that happening, and I think part of the what can take place is using what's been learned by the JDAI counties and trying to translate that across the whole system and across the whole state. So I think that that's a great point to bring up. I'd also like to say there are individual counties that are doing a really good job with their data. So it's not, this isn't to disparage everyone in the state of Indiana. I think the idea is what can be said at a state level is pretty limited right now. Mm-hmm. Even though there are some individual counties and some individual state agencies and some small pockets of strong data cultures and using data in a very good and consistent way. So I think there's a lot to be built upon.
Thank you, appreciate that.
And I'm sitting here going, amen, amen, hallelujah, this is great. Oh, wait a minute, I think so this is inconsequential in the great process and the opportunity, and I think this is, as long as we're all on the same sheet of music, what can we do to help you? What can you do to help us? What can we do to inform our legislative colleagues so they can prioritize their policies and inform those policies? This is very exciting. This is very, very exciting. This is reform on steroids, which is great.
So I'm going to go on to the recommendations section. I think your point, this is reform on steroids, is obviously this can feel overwhelming. There are a lot, especially if you look at the memo, a lot of recommendations, a lot of areas that we've identified for improvement. But I think this is also a good way to help everyone around the table prioritize areas for improvement, and really think about what do we want the juvenile justice system in Indiana to look like, and what are the steps to get there, and where do we prioritize right now versus in the future? And I think that was the ultimate goal, and not to overwhelm people with look at all of these challenges and make folks feel like it's insurmountable, because that's not the intention. And I think there are a lot of great elements in place and foundational things that are happening that we can build upon. And so the next section, and I know we're somewhat limited on time, we've laid out and highlighted some of the key recommendations that were included in the memo, but in the presentation, we've also included some very brief examples from other states around the country that have addressed very similar challenges. And obviously, as we move forward and hopefully conduct a deeper dive assessment leading to policy change, we can share more around what these examples are and how these states have been able to adopt change and implement changes and provide those kinds of resources to you all in greater detail. So in terms of the first set of recommendations, we consolidated recommendations here around diversion, detention, and dispositional decision-making or supervision to say that there are opportunities for Indiana to establish statewide policies to better match young people with the most appropriate level and type of supervision that is based primarily on their risk of reoffending. So this includes developing a statewide strategy to divert low-risk youth, including youth committing status offenses, from involvement in the court system, whether that's pre-arrest or additional post-arrest diversion opportunities, and helping to meet their needs outside of the juvenile justice system, creating statewide policies around who is eligible for diversion, how to better screen kids for eligibility, as well as policies around supervision and service delivery for those young people on diversion. Limiting the use of detention for those reasons that are not public safety in nature, and as well as restricting the use of detention as a sanction for a violation or as a dispositional option, and better creating policies around the use of a detention screening tool to inform detention. Establishing dispositional decision-making tools and guidelines, including how to better use risk assessments and validating that risk assessment, which I know is happening right now across the state, to inform the length of time on supervision, as well as to inform the best use and the most appropriate use of out-of-home placement. And establishing standards or guidelines for juvenile probation policies and practices, including using graduated response matrices, limiting the use of technical violations, and other probation policies. And just to give you a sense of what other states have done, North Dakota, I think has passed it. If not, it's about to be passed out of this legislative session, a bill that decriminalizes what they call unruly offenses, their status offenses, and separate those youth away from delinquent youth in statute. And then the bill also designates county social services agencies as those entities responsible for providing services to those youth in lieu of an arrest and in lieu of court involvement. Florida is an example of a state that has a pretty robust pre-arrest diversion program, a civil citation program, to divert young people with misdemeanor offenses away from the juvenile justice system. Colorado recently revised its statutory language around the use of secure detention to limit the use of detention only for public safety reasons, as well as requiring the state to revise and revalidate its detention screening tool. And then a number of states require the use of risk assessments to inform dispositional decisions and supervision lengths. And a lot of states have implemented graduated response and incentives grids or matrices for use by probation departments to address probation violations or reward positive behavior. And I've listed a few of those states, but there are a number of other states as examples. I'll probably pause at the end of all of these and see if there are comments or questions. So the next section around service effectiveness, some of the recommendations that we've provided around establishing processes, policies to make sure that services are effective and that the state is using limited resources most efficiently around service delivery. So establishing a process for how funds from the state are allocated for providing services to youth in the juvenile justice system in a data-driven way that's based on youth's risk and needs, and that are focused and prioritizing those services that are research-based. Creating statewide policies to guide the use of residential placement and limiting the use of that placement for public safety reasons or for youth that have significant or more intensive behavioral health needs. Identifying opportunities to reinvest resources back into community-based services away from residential facilities, and expanding or strengthening the availability of intensive community-based treatment options, particularly in more rural jurisdictions. And then the last piece around strengthening, training, fidelity monitoring, developing quality assurance tools, and collecting performance data or outcome data for service providers and counties on the effective use of resources when it comes to the delivery of services for young people in the system. And just some examples, a number of states have established requirements that most, if not all, funding from the state that goes towards juvenile justice services can be used for those programs that are deemed as evidence-based or research-based. Again, a lot of these states also, to the point earlier, reserve a certain percentage of funding for innovation and for those locally grown programs that are not yet demonstrated by research to be effective. A number of states have created pilot programs to help increase the availability of intensive community-based treatment services. Illinois and Ohio are two examples of states that have established service funding models that incentivize local counties or communities to lower their incarceration rates and instead use that money to provide services in the community as alternatives to incarceration. And then I mentioned this earlier, Colorado is an example of a state that enacted legislation requiring the development of shared performance measures for service providers that are serving youth in the juvenile justice system. In terms of alignment of the system with more developmentally appropriate positive youth development approaches, a recommendation around establishing a lower age of juvenile court jurisdiction, and then at the same time, making sure that there's a system in place to provide services and supports for those younger youth and their families to be supported outside of the juvenile justice system, strengthening the current continuum of services and interventions for young people that are in juvenile facilities, and eliminating those programs or services that are not demonstrated by research to be effective, as well as providing more transitional and reentry services and supports, limiting the use of fines and fees for youth and families involved in the court system, and as well as limiting collateral consequences for youth as a result of their involvement in the system, particularly those barriers to education and employment. And then making sure that the highest risk youth are matched with the most appropriate supervision and limiting the ways that they can be supervised by the adult criminal justice system and bringing them back into the juvenile justice system whenever possible. Again, some examples, we've seen 13 states so far establish a lower age of juvenile court jurisdiction of 10 or higher, and there's current legislation in a number of states that would also establish a lower age of at least 10. We've seen in the last several years, at least 40 states changing their laws to make it harder to send youth to adult court and making it harder to treat children as adults by limiting or ending their automatic transfer laws. A lot of states and counties are using standardized tools to help assess the quality of services in their facilities and to make sure that those services are effective. And many states are shifting away from these larger scale facilities to more therapeutic, smaller facilities. And we can talk more about that if folks are interested. Missouri is one example, Texas is another. And then a number of state and local juvenile justice systems are finding ways to more meaningfully engage youth and families in decision-making processes and in services, and are formalizing these approaches in a number of different ways. And then the last set of recommendations around establishing statewide performance measures and really improving the collection, tracking, and use of data so that Indiana can really base decisions and resource allocation decisions on data. So outlining key system performance measures, including using multiple measures of recidivism and collecting data on positive youth outcomes. This includes standard data definitions and data practices across the state, as well as creating requirements around annual reporting of juvenile justice data, building capacity at state and local agencies, as well as the necessary infrastructure to be able to analyze juvenile justice data, to create linkages across data systems, and the last one around making sure that system performance and youth outcome data is incorporated into decision-making processes. So getting buy-in and support across the system and across the state that the use of data is important and in terms of driving decision-making and continuous improvement, and providing the kind of technical assistance and support to those agencies to be able to make data-driven decisions. And here we've outlined a number of states, some similar to Indiana in terms of having a state local system where a lot of the system is run by county agencies like Texas and Pennsylvania. So for example, in Texas, the Department of Juvenile Justice collects data from the court and probation systems, which are county run. And then the state extracts case level data. It requires an extract of case level data that's submitted to the state by the county departments monthly. And the state has developed specifications for data elements and the formats for how that data should be submitted so that there is consistency and standardization. Pennsylvania as well has a county run system for the most part, but it utilizes a statewide case management system to collect and report data from each of the county run juvenile justice agencies. Iowa is a very similar example where they have a juvenile justice data warehouse that collects information from the 8 judicial districts and provides access to juvenile court statistics from each of these judicial districts. And I think Florida and Texas are probably the best examples of the most comprehensive data systems that we've seen across the state. Florida has a very comprehensive data system that links information across various points in the juvenile justice system. And they have a unit within their state agency that publishes rules for how to use the system. The state website, which we can share around, publishes performance reports. They have interactive data dashboards. So kind of an aspirational way for you all to think about what is possible in terms of using data to drive decision-making. So I will stop there just to see if there are any reactions, questions. Do these recommendations and priority areas resonate and make sense? Are there other recommendations or priority areas that you didn't see either on the presentation or in the longer memo that you would want to ensure is included in any sort of deeper dive comprehensive assessment? I'll also see if Emily, Josh, I know I tried to go through that pretty quickly. Anything that I missed that you would want to highlight, make sure that we point out.
No, I would just underscore these were our initial reactions and recommendations based on this initial assessment and based on the research and what we know from other states. But the goal of the next step, and we'll lay that out at the end, is to really be guided by you all about your priorities and focus the deep dive analysis on what do you see as the biggest priorities in terms of improving public safety, improving equity, and improving youth outcomes. So great to get any initial reactions to that now.
This is Rudy again. I really like the recommendations. The only thing that I would add perhaps is, and I only mention this because I've been seeing these issues of late, Were there individuals that came from other countries that start growing up in our state and probably didn't have access to programming that dealt with our differences in culture, and also with regard to the issues of immigration? So I just think that might be something that we might want to be able to address and as we press forward.
Any other thoughts or additions or?
I would just add that I'm not sure that we can do all of this without centering youth and families in this work. We could do it, but if we really want what is going to be most effective and most impactful for those that we serve, we have to bring in those and value those who are impacted by the system. And I know I saw it in a couple of slides, but just encourage us to think about how to bring that to the center of this work instead of those of us who are the professionals trying to impart to those who are impacted by the system what we think is best. And that overlaps into the equity piece, because those most impacted are our youth and families of color right now, unfortunately.
Yeah. And
Nancy, and I think we need to think that on both the micro and macro level.
I would say, Nina, there's a reciprocal nature when you create policy, that whoever you're creating that policy for, and I think what Nancy is saying, that the people have some say-so in the policy, because it may not be a good policy if the people aren't aware of it or don't understand it. So when we talk about the community, whether they're our parents, our kids, and our schools, I think it's really important that those major stakeholders have a little bit of say-so or understand what's going on in the language that they understand. This is a very technical language. Yes. It's like you guys are speaking a foreign language to a lot of people. You understand what you're saying amongst each other. Fortunately, I've been able to be a part of that, so I understand all the different concepts that are out there. But for regular lay people, they don't have a clue as to what you guys are talking about. So it's almost like you have to dumb some things down for them to understand what we're trying to accomplish. The last major reform for juvenile justice that took place many, many years ago, the schools were not brought along, and therefore we were hit like a bombshell, and we were trying to play catch up. So we just want to be brought along, and the community wants to be brought along as we make these significant changes, because I believe that a lot of changes that are in your recommendations are pretty good recommendations.
So I always love when folks are reading my mind and reading the next slide before I get to it, because one of the really important pieces of our next steps, if we were to do a more comprehensive assessment, we can talk more about it, is how do we ensure that youth, families, and communities are not just part of the process of collecting information. And it's not that we're trying to take information from you, but we're also including communities, youth, and families in the solution development process. We're hearing from youth and families and communities about what's going on, about what the challenges are, and then they're helping create those solutions. And we're partnering with, the goal is to also partner with community-based organizations, with liaisons that can help translate information, that can help debrief with youth, families, and communities, that can really be trusted partners, and have that relationship on the ground with communities that folks around this table might not have. And so that has to be a part of the next phase, and would love to brainstorm with folks around the best way to do that. But we think that that's an integral part of the process and the next phase of work in conducting that assessment and developing real policy solutions, is how to really bring those voices to the table and how to make sure that they have an authentic platform to be part of the, not just what are the challenges, but what are the solutions and how will they actually impact us on the ground.
And just to build on that, as Nina said, so the next phase of our work, hopefully, would be a deeper dive around the data, but also deeper dive around these issues. And then the goal is to come to consensus based policy recommendations, practice recommendations, funding recommendations, but those are not our recommendations. They're your recommendations. They're the agencies that are implementing these policies and programs on the ground, and they are the recommendations of the youth, the families, and the communities that are most impacted by these recommendations. So as it lays out here on the next steps, our hope would be that this initial assessment has gotten people excited enough, invested enough to understand that there are some significant challenges and opportunities for improvement, and wanting to be supported by us with the research, with the data, with the facilitation, to partner with youth, families, communities, and agencies across the state to come to consensus on how the state can best move forward.
I don't have anything to add other than I'm excited about sharing and having discussions and ensuring that our senior judicial leadership that lives this work and all of the local partners and participants that they are involved in gets a chance to look at this and comment on it and maybe inform it, expand it, shape it going forward. I think that would be taking advantage of a great opportunity. May help directly or indirectly with prioritization and ensuring that none of us inadvertently miss something. So we'll do that.
Senator Kreider or Representative McNamara, any thoughts in terms of next steps or the recommendations that were made and carrying this conversation going forward?
So the next steps for Senator Kreider and myself are really for the two of us to get together. For those of you that are on the call, the funding is going to be a big issue. So in our respective caucuses, we'll need to advocate for that deep dive funding. We have a couple of sources for that. So those are our next steps. But additionally, once the deep dive starts and we get the results from that, we'll probably form subcommittees to focus on specific tasks, so that we're not just one big group taking 5 bullet points. What I would like to see is if we have 5 bullet points, we have 5 groups focused on specific and intensive look at that particular issue that we're facing. One of my biggest concerns is just the data piece, more so than anything, is just making sure that across the board we are able to get accurate data from all 92 counties, and make sure that when we're looking at things that everybody's speaking the same language. And then my end goal would be to have everybody in the state speaking the same language and really see some positive results from that in the end. But that's just my thoughts going forward. Is, right now a lot will be on Senator Kreider and myself to put everything together and then make you guys get to work.
And I think that last piece around the data, as we're doing that deeper dive assessment, if we're able to do that simultaneous to that, we would be able to support the state in building the capacity to collect and use and track data. There's some things that can be done. I think Josh or Emily mentioned this earlier, in the near term that are very low resource intensive, creating standard definitions, statewide performance measures, things that the state can get started on without waiting for you know, consensus moving forward, you know, like that whole process. There can be a data working group that's already getting started on some of these data concerns. So that's definitely a priority.
I agree with Representing McNamara that the consistency of data is really important. I don't know if anybody on the call has any concept for how much money would be required in order to kind of create an opportunity for all these different systems to communicate. But if you do have that information, if you could get it to me over the weekend, we're going to have a couple of days of opportunity to talk about budget items and things and opportunities. And so, you know, I'm a member of the Appropriations Committee in the Senate, and I know Wendy is very connected on the House side. And so we should try to seize an opportunity if we have it, particularly with the revenue forecast that we receive.
Any other thoughts, comments? A couple minutes left. We'll also share this presentation. I know we shared the memo, but I think this is a much more concise version of that. So folks can share this around. Again, we're happy to answer any questions, or if there are particular examples that you want more information on. In the meantime, we're happy to send more information or connect folks with other states as well. But looking forward to the potential of doing that deeper dive assessment and helping the state get started. So hopefully we'll all be back in touch in the near future. Any other last comments? Julie, did you want to say anything as well?
Yeah, I'll just mention quickly that a much briefer summary of this will be presented at the Children's Commission meeting next Wednesday, the 21st, from 10 a.m. to noon. So if you, I mean, that's the full meeting. This will be about half an hour of that meeting. So if you know folks who should see this summary, who haven't seen this meeting yet, invite them to watch the Children's Commission meeting. And that the nice thing about that is also the folks who are around that table are also additional policymakers and decision makers. And so I think it's going to be interesting to see what questions they have and, you know, how that conversation continues. Also, this meeting, as I mentioned at the beginning, is being recorded. And so as soon as we're done, we're gonna, you know, get our caption file corrected and match it up and turn it into a YouTube video. So hopefully we'll have this posted on the Children's Commission website within the first half of next week. So you can also share that out with folks as well who you may want to see this full presentation.
Great.
And just one last thing, sorry, Senator Kreider, I will see if I can make some calls and see if I can come up with some numbers for you.
Thank you.
Mm-hmm.
Great. Well, thank you all so much. I know this is a lot of information in a short amount of time. So thank you all for your participation and commitment and leadership. And we look forward to continuing the conversation.
Thank you.
Thanks, everybody.
Thank you.
Thank you.
Thank you.